Hey guys, my name's Brittany. I actually work with InMode Medical, and I am here at Ageless Skin Rejuvenation with Rachel and Sarah, and we're going to talk a little bit more about the Morpheus. So Morpheus I think is fantastic because in general it's RF microneedling, that's radio frequency microneedling. So it's going to cause 3 injuries to the skin. That injury is a physical injury with needles, then there's heat, radio frequency to tighten the tissues. That's going to cause a stimulation of collagen and elastin to promote skin tightening and really heal some of those things that we would like to fix or correct or make ourselves feel a little bit better in our own skin. So radio frequency microneedling, one of the benefits is that it does so many different things and it's a huge mixed modality. So we're able to retexture the skin, but in addition to that, it's really deep tissue tightening. So I can treat fine lines, wrinkles, deeper wrinkles and folds, acne scars, cystic active acne I now don't have to avoid. I can actually kill some of the bacteria to stop the flare-up. And then I can come in and I can actually contour the jowls. Everybody's talking about the Zoom boom and this whole area right now. So we can contour the jowls and then we can go down to the platysmal bands, tighten the neck folds, and then again just continuing all the way down the body. We can actually treat hyperhidrosis, abdominal laxity, as well as laxity on the arms that people have. We can help with C-section scarring or any kind of surgical scars that you have. And then we can go down to the legs to get the little banana rolls or cellulite or stretch marks and things like that. I hear things all the time that people do, their fingers, their cankles, all of these crazy things. If you can think about it, you can ask these girls, and honestly, they can probably Morpheus it. So there is nobody that's a better pro. I say this all the time, but I use her name quite a bit. Rachel King, she does quite a bit. She actually was the #1 user in Virginia for Q1. So in our little small town of Virginia Beach, that has to say quite a bit. And we all want to look good and feel good in our skin, and she has all the bells and whistles to do that, but in addition to that, Morpheus is one of the big ones, again, because it's able to treat all these little things that we just talked about. So I'm gonna pass it over to Sarah. She's gonna tell you who's a candidate, who's not, maybe go over some of the post-op kind of stuff.
Hey guys, it's Sarah, and I'm gonna be talking to you today a little bit more in depth about the Morpheus 8 treatment. So what I really love about the Morpheus overall is it's great for most people. Most people are a candidate for the treatment. So we can treat all skin types and we can treat year-round, which is really important when it comes to the amount of remodeling that this device can give a client. So what I love most about the Morpheus 8 is how customizable it can be. So if you go into fractional on the Optimus base, I already recognize that we have our Morpheus handpiece right here, and the standard is the regular 24 needle tip. So the 24 needle tip can be used for all over skin tightening, remodeling. It can burn stubborn submental or jowling fat. It can also treat the body if you really want it to. We have the body handpiece as well, which is a little bit larger. It has 40 pins. And then from there you can adjust the depth. So we as the provider know the depths that are going to be efficient for each area that we're treating. So if we're somewhere bony, like around the eyes or somewhere really thin, we can be a little bit more superficial and still get smoothed out fine lines and just an overall better appearance. If we're somewhere that's a little bit thicker and more stubborn, such as the submental area where we get that double chin, we can go a little bit deeper and turn the radio frequency up higher to get a more effective result. So prior to your Morpheus appointment, it's super important that you stay out of the sun for a couple of days. We also, a few days prior, want you to go ahead and stop any actives such as retinols, and if you're on any blood thinners, we need to be really cautious, and we can talk to you more in depth about that during a consultation. Post-treatment, you're going to be a little bit red. It's similar to a mild sunburn. You can be a little bit inflamed or have marks that look a little bit welty. This is a good histamine reaction that we want. It means the treatment is working for you. So it's nothing to worry about, and we can always talk more about what you're going to look like after as well in a consultation. At the end of the day, the Morpheus 8 offers very minimal downtime when it comes to the outstanding result that you can achieve. And now I'm going to pass it on to Rachel, and she's going to be talking to you more in depth about some pain management for treatment.
Hey guys, I'm Rachel, nurse practitioner and owner here at Ageless Skin Rejuvenation. I'm going to continue discussing one of our favorite treatments here at Ageless, which is our Morpheus treatment. I'm going to kind of dive into the whole pain management and talk about the multiple different options we have for different clients. So pain can be very individualized and different for all of our clientele, as we know. So that's why we try to provide multiple different options, not meaning that any certain person has to have any amount of these options we're going to talk about. On average, our typical Morpheus client just uses a topical numbing cream for about an hour, and they are completely comfortable throughout the treatment. But as we learn to get to know our client and we talk about their needs, we can also offer multiple different options. But I guess one of the basics we can start with is distraction. Distraction can be something as simple as putting something in one of the client's hands so that they can squeeze, such as a squeezy ball, or you guys probably see a lot on a lot of videos, like a certain vibratory tool where you can put on a bony prominence, and that offers distraction from the service that's being provided. And a step up from distraction would be a numbing cream. And as I mentioned before, on average, these are the two things that most of our patients use to get through their Morpheus treatment. Numbing creams can come in all forms, can come from all different kinds of compound pharmacies. We use one that is a double compound, lidocaine, tetracaine, 23.7%. But again, there's no right or wrong there. There's BLT out there, different compounds, different strengths. They all work pretty effectively. Another form of distraction we can use is a chiller, a cooler, a Zimmer. It is a machine that blows out pretty cold air, which helps distract the client from what's going on. We don't necessarily use the cold air on the treatment because part of the treatment's results come from the heat, and we want to maintain heat by using the cold air just across an area that's not being treated, or we can use the cold air to chill an area if we are going to go into like injectable numbing, which I'll discuss soon. Another great option for pain with any service, and especially our Morpheus 8, is our Pronox. This is pretty well known in the aesthetics community. It is a 50-50 blend of oxygen and nitrous oxide. Somewhat similar to what you would get at laughing gas in a dentist's office, just a little bit of a different blend. It immediately enters the bloodstream in approximately 3 minutes, so it's quick and effective. But also because of the 50-50 blend, it also exits just as quickly. So you can leave the office within 7 minutes, you don't have to have someone drive you, and it's just a good add-on or an alternative to some of the other options we talked about today. And lastly, we're going to discuss if someone would choose to have some injectable numbing done. Again, not mandatory, not a lot of our clients need it done, but it's an option if necessary. It's very simple, an office procedure. They could use it after topically numbing and or instead of numbing topically. Again, it's a conversation we'll have during our consultation to see what's going to be best for you. But we would just utilize one of our regular simple, either a 10 or 5 ml syringe. And then I utilize one of our 18 gauge needles to pull up the solution. At Ageless, we do a 80-20% blend. So we'll do 80% of lidocaine 2% and 20% of sodium bicarb. So for example, in a 10 ml syringe, we would have 8 mLs of lidocaine 2% and 2 mLs of sodium bicarb. And that 10 mLs is plenty enough of solution to treat any area. The solution can get to the area of treatment multiple different options. It can be something as simple as fanning with a needle. Our needle of choice is a 27 gauge 1 1/4 inch length. And you can have one insertion point and kind of fan all over the entire area. Or if someone likes to use a cannula, you could use a cannula. Our favorite here is our 2 inches 25 gauge TSK cannulas. And again, same thing, just one little pinch for an entry point and fanning, numbing in the area. Some people refer to it as like a tumescent solution to numb the whole area. And then also can be used is something called a mesoram. Mesorams come in different shapes, circles or linear, and they come in different lengths, anywhere from 2 to 6 millimeters. What we do here on average is a 4 millimeter is going to be used for the face, 6 millimeter for the body, and the shape choice would be determining which area we're treating. So an end result would look like a syringe filled with solution, goes right onto the mesoram. You inject the mesoram just like you would any other needle into a client, and it comes right out the end there.